Hello, everyone, and thanks for tuning in. I'm Amanda Ziadeh with WashingtonExec, and with me today is Ken Hofgesang, Vice President of Health at RELI Group. Thank you for being here today, Ken.
Thanks, Amanda. It's great to be here.
Of course. So we're here to talk about the success drivers for the Centers for Medicare and Medicaid Services Comprehensive Error Rate Testing Program, which is used to properly measure payment compliance for Medicare's fee-for-service initiative. A little bit of a lot of words there, but this program does so by reviewing a sample of FFS claims to determine if they were paid properly under Medicare coverage, coding, and payment rules. A little bit of background: in fiscal year 2024, according to CMS, the Medicare FFS improper payment rate was estimated at 7.66%, representing $31.7 billion in improper payments. So while this doesn't indicate fraud necessarily, technology and teams that support the CERT program are working to reduce improper payments by updating CMS's internal processes and educating providers. So with all that background, Ken is here to share the impact of CMS's CERT program and how the agency can ensure financial management and improve measuring and reporting to better serve healthcare providers and citizens. Before we dive all into that, Ken, can you start by telling us a little bit about RELI Group and your role there?
Sure. So as you mentioned, I'm the Vice President of Health for RELI, so I oversee all of the federal health contracts. And then we have a separate branch for the national security work that we do. But, RELI has been in business since 2013. We were founded by Mohammed Elias. And since that point, we've been a real trusted partner to federal agencies, delivering innovative solutions that I think really address today's complex issues that across health security and technology. And we really look to collaborate with agencies throughout the government, touching on the lives of every American with the goals of improving health safety and national security. And I think really that comes down to the skilled professionals that we have who embrace innovation, collaboration, and then continuous learning to really meet our clients' needs.
All right, wonderful. So when discussing the comprehensive error rate testing program from CMS, can you highlight the importance of this work and why it's critical for CMS?
So thank you. Great first question. I think you gave a lot of background already on CERT. But, I think the CERT program is so important because it measures the payment compliance for the Medicare fee-for-service program. And really that ensures that those payments meet all the federal rules, regulations, and requirements to ensure that there is complete transparency between, start to finish. CERT performs that critical function because the U.S. public relies on CMS and other federal health agencies for healthcare support. And those are the folks that I think every one of us have an attachment to. These are our grandparents, our parents that are all using CMS services, and it really is a trust that needs to be extended and funded out into the future. And so CERT really provides a vital function for CMS to preserve that trust and track those improper payments and then possibly recover funds from that. Ultimately, CERT performs error rate testing, reporting, and tracking of improper payments, as you mentioned. And those outcomes ultimately are reported to Congress and then become public. So it's important for CERT as it helps CMS describe those key actions needed to reduce improper payments in the CMS programs. It helps CMS become more efficient in providing and preserving that trust moving forward.
Thank you for expanding a bit on that background. So Ken, then how does CERT support CMS and the agency's overall mission operations?
So, this is where I love to tie this back. So, what are our goals at RELI is to really address inefficiencies, deceptions, and resource mismanagement issues in order to maintain organizational integrity across the health community. And I really feel that aligns closely with the CERT program because ultimately we want to ensure that improper payments are tracked appropriately and quickly, and then establishing that basis for program integrity. So when we say we're going to do something, how do we say what we do and then be able to tie that back? And I really feel that that's a key part of CMS's overall mission. As the agency works with the entire healthcare community, to really improve quality, equity, and outcomes in the healthcare system, it's essential that we trust and we can validate the baseline that's funded on. That process is supported through, various functions, but one of the most important ones is appropriate data management solutions. As experts in data management solutions, I think we and others in the industry understand CMS and the healthcare providers and that they must track all that information accurately and effectively. And to do that, there's really three key points of technology that they must be able to work with. And the first is, have the ability to analyze complex data and generate insights into supporting strategic planning. The second piece is to identify other trends and risks while monitoring, for improper payments and then ultimately enabling solutions from that. And the third piece is the ability to guarantee that they're delivering accurate, actionable intelligence to support the CERT program actions. And I think when those come together and we implement the approaches and technology solutions that follow those guidelines, ultimately will empower CMS to track improper payments while also informing the federal health community of the issues around that.
Right. Wonderful. So let's dive into the technology piece a little bit more. I understand that artificial intelligence has been a key driver of success for federal agencies the past few years. So is AI playing a role in CMS's monitoring, measuring, and reporting of improper Medicare fee-for-service payments?
So I think that AI is already playing some roles in various pockets, and I think that is definitely a future enhancement as well, and it will play a larger role as we develop AI technologies. I think at its heart, data management and analytics bolster the detection efforts for CERT's work, and really expanding their ability to uncover improper payments. And one of the things that I think AI is going to have the biggest impact on is volume. So right now, sampling sizes are relatively small. As we get more efficient and AI gets introduced at a higher level, I really think we're going to have the ability to expand those sample sizes and maybe ultimately be able to sample 100% of those payments, which is not on the horizon right now. And then through that, we'll definitely uncover more fraud and waste. I think through those cloud-based analytics platforms and comprehensive data management plans, CMS and other federal health teams are going to be able to use AI to gain an actionable insights into where those improper payments are occurring, and then what priorities need to be addressed, and also be able to track those trends as improper payments and even fraud patterns change in the future. Be able to get out ahead of that and kind of model it and be able to then counteract that. Along the lines of proper data management, I think it really includes enhancing data discoverability, supporting advanced analytic solutions, and then intertwining the data quality with all the various data pipelines that come into CMS, while ultimately securing that data in transit and at rest. So not only can we use the AI piece for the advanced data analytics, but also how do we secure that data? How do we tag that data? And how do we ultimately create a system that is, I think, more easily worked with, right? So healthcare data is one of the largest targets in the world right now for bad actors. And ultimately, we have to have an understanding of everything that's in there in order to be able to protect that. I really think it's important to establish processes like the comprehensive collection mechanism for metadata. And we touched on that a minute ago, but ultimately establishing and then assigning that metadata at various stages of the data flow that comes into CMS, and then developing tools to create a data discovery catalog, really leads to three things, and then also allows to kind of future-proof that data as it comes in. So the first is that, it really allows and leads to metadata visualization maps, which are going to allow CMS to understand its data footprint and its data history. So that is part of that future-proofing. The second piece is, really without that visibility, health agencies are flying blind. And as new data types and categories begin flowing in the next year in the near future, you need to be able to adapt and adjust. And the third piece is, I really think that CMS needs to build its data foundation by implementing the data quality framework and then interlacing it with pipelines to monitor the accuracy of the data coming into the system. So while CERT is there to validate and detect, we have to be able to be certain that the data that we're working with is accurate to start with, and then measure on that. So that's another key component to it. Getting back to the AI piece, I think that the data itself can be acted upon through various forms of AI. One of the things that we're working with are implementing large language models in our review process to be able to go through, identify trends and speed up that review work. And that ultimately will get back to, one of the earlier points, which was, how do we increase that sample size? How do we get from the 5, 10, 15% with AI? Can we get it with the same number of people? Can we get that review up to 50% sampling sizes? So really looking to implement that. And I think through large language models, that can be one path towards that. And then ultimately, I think on this topic, the use of AI technologies and strategies ultimately will make the government operations and CMS's operations more efficient and really allow CMS to root out improper payments and expand the review data sets, as we talked about, to get a higher statistical sampling so that we can go across and uncover more things, ultimately providing, a better healthcare outcome to our both healthcare providers and, every American that uses CMS.
All right, wonderful. Thank you for sharing all that. I know that when we talk about mass amounts of data, processing, securing, analyzing, there are endless applications for AI in this field. So I appreciate you sharing some of those examples with us. So Ken, what other tactics can CMS implement to ensure stronger operational efficiency for CERT and more effective financial management for CMS?
So we've talked a lot, I think, on the technology side and in the AI side already. And so I'm going to switch that slightly. And, I really think that it comes down to a combination of all the aforementioned topics and then really having the correct people to help CMS and the CERT program in their financial management journey. That part is just as essential as the technological component of it. Stakeholder engagement and collaboration are always keys to successful programs, regardless of the topics. But finding trusted partners that understand and know CMS's mission, their problems, the constraints, I think that's really necessary for the successful implementation of the next generation of the data management platforms, and then also having any kind of ability to develop those AI solutions is going to be dependent on a full understanding of the history that's there, how that data came to be, and then be able to implement that going forward. So I think that those partners with a history of fulfilling CMS needs will provide better cost-effective solutions, and really tailoring, allowing that to be tailored, regardless if it's custom work or if it ends up being COTS products that are integrated into the environment, allowing for that tailoring that's going to be needed to have it actively work within the CMS federal space. So I think that, CMS needs to search out organizations with that experience in solving a array of use cases across the federal government, because that's where I think the other piece of this collaboration can come in. Partners with experience in policy, data analytics, and technology, they're going to approach data management solutions focusing on the goal first and then meeting the federal government's mission with that efficiency and optimizing resources. And there may be, we talked about the deep understanding of CMS and their mission. There may be some efficiencies that can be pulled in from other government organizations as well to provide best value for CMS moving forward. So while I say that, I think that, ultimately all of that must occur while remaining compliant and optimizing resources within CMS. So it's a balance, but I think it ultimately comes down to partners that can team with CMS to really provide the institutional knowledge, the broader best practices from other government agencies, couple that with technology solutions, integrate that with some AI, and then move that forward into the next generation of systems to service CMS.
All right, wonderful. Well, before we close, Ken, any final thoughts on how to ensure these success drivers for the CERT program?
So I think there's just, for me, there's 3 points to take away. The first is that, I think efficiency is a priority for most federal healthcare agencies. So enhancing CMS's ability to better track and understand where improper payments are occurring ultimately will play a key role in the federal government's larger push to streamline operations and cost and as one of the largest budgets within, the federal civilian side, it certainly is. I think that efficiency piece top of mind for CMS. The second key takeaway, I think, is that AI really has the ability to help CMS and the agency's CERT program overcome challenges by automating specific tasks that can effectively monitor, measure, and report improper payments. But with that said, I really think that the people and partnership is just as important as CMS looks to create that team that will move the CERT program forward. And then lastly, I just think that, as an organization, we RELI understand the current and future challenges facing CMS, the CERT program, and other federal health agencies. And we're really looking to work to enhance financial management strategies, including Medicare fee-for-service payments. The work will in turn create a better user experience for every American citizen, and ultimately deliver stronger healthcare outcomes. So, I really appreciate the time, Amanda. Thank you.
Thank you so much.